We are back with After the Bell. This is episode 4, and it's a real special one because this podcast really is for all of those touched by cancer, whether it be the person going through cancer themselves, or somebody who is a caretaker, or somebody who is even a previvor. And today we have a previvor with us. That is my sister, because both me and my sister have the PALB2 genetic mutation. It's PALB2. So I really wanted to bring her on to get a perspective, a unique perspective on being a previvor, being sisters with somebody who's experienced cancer, and just kind of just chat about it because it's not talked about a lot. And I really wanted to hold a space for that. And my sister is a very well thought out human. She is very pragmatic when she's talking about things like that. So I think she's a really good resource for previvors and, people who are supportive or who are support to cancer patients or survivors. Before we get into the actual conversation, I really want to just touch base on what PALB2 is. The name PALB2 stands for partner and localizer of BRCA2. The gene is located on the chromosome 16, and PALB2 works together with BRCA2 to repair damaged DNA. So oftentimes, PALB2 is referred to as BRCA3. So BRCA1 and 2 are very common. A lot of people will immediately know what you're talking about when you bring up BRCA. But PALB2, it's not the same. It's not where people are aware of it and they will know what you're talking about. But there is a really high risk for breast cancer. The general population has a 13% risk of getting breast cancer generally. If you have the PALB2 genetic mutation, your risk is 40 to 60%. Now, not just breast cancer, there is a small increased risk for ovarian cancer and pancreatic cancer. Ovarian, the general population is about 1% risk for getting ovarian cancer. But if you have PALB2, there's a 3 to 5% chance. And for pancreatic, there is a smaller chance. It's limited data, but they do state that there is an increased risk for pancreatic cancer. So that being said, let's get into this episode. I'm talking to my sister. We're just chatting about our experience, and I hope you enjoyed. So meet my sister, Jaime. So I have my sister here with me, Jaime. I am super excited to have her on today because she is a previvor. We both have the PALB2 genetic mutation, and since I've been through everything with breast cancer, a lot has changed for her too. So I really wanted to dive deep into the world of a previvor, what it's like, talk about PALB2 because it is something I don't think is talked about enough. So I'm here with you, Jaime. Welcome.
Hey.
So just for those who don't know you, just give us a little rundown of how kind of you've gotten to where you are today as, someone who has taken action as a previvor. I know that's a long story. So try to we can cliff note it.
So my health background is kind of complicated, but also kind of not. I was sick a lot as a kid. A lot of things were unfigured. That's a terrible set of
unfigureoutable.
So we couldn't figure out a lot of things. Yeah. When I was a kid, we couldn't figure out a lot of stuff. Like there were a lot of dysautonomic symptoms that I had that, I went for lots of tests for and they never came back. I was at neurologists and heart doctors and all kinds of things. And they never really figured that out. And then as an adult, I started dealing with chronic pain in my 30s after an accident. And as I was dealing with all that stuff, I started having health issues too, but they kind of got pushed to the wayside because I was dealing with the injuries. So fast forward that to 2017, I moved in with my current husband at the time, and was getting sick for no reason. I lost a lot of weight, blah, 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 same thing. Doctors didn't know what was wrong. And so I decided to get genetic testing done just to see if there were options that I hadn't seen before. So I went to the genetic doctor. They said I didn't qualify for the testing because while we had a lot of cancer in our family, there wasn't enough people having the same kinds of cancer to make it worthy of, I guess, insurance covering the cost. That being said, I ended up paying for it because I just kind of wanted the information. Um, and then I remember they called me and they were kind of like, well, this isn't what we were expecting at all. And then the PALB2 was brought up. Now, at this time, no one in our family had ever had any genetic results or things like that. They threw out things like going on tamoxifen or double mastectomies, and all of that seemed like really extreme for someone who had like just shown up to get a genetic test, and then like all of a sudden a couple of days later they're like, hey, why don't you have these life-altering surgeries? So like when I found that out, I emailed all of our cousins and our immediate relatives. I emailed you. No one seemed super interested in having the test except for you. I got some really strange responses. And then you turned out to find out that you also had the gene. Now, at the time, I was 34 when I found that out in 2017.
No, 18 because I was pregnant with 20 when I got
you were 2018 when you found out.
Yeah.
Okay. Yeah. So when I found out, basically I just committed to doing every 6-month testing. I was going to go for the MRI with the dye and the mammograms and things like that. And I started doing that because the tamoxifen seemed too extreme, and they were saying things like it could actually increase your risk of cancer if you're on it as you like go into menopause. And there was like just a lot of side effects and things that I wasn't interested in at the time. And then I started having the mammograms, and every single time I had the mammograms, I was getting called back to do an ultrasound because either really dense breast tissue or they saw something, or there was like light that they saw, like whatever it was. I just am constantly being called back in for these things. And then I guess it was 2021 that you found out that you had cancer.
Yep.
So that kind of changed my whole perspective on the whole situation. Once I saw how much you had to go through as far as treatment goes, and then even after that, watching what you had to go through or what you're still going through as far as like prevention of recurrence. There's a very different approach to preventing something that hasn't happened and trying to stop something that has already happened from happening again. And so for me at that point, the double mastectomy made the most sense. Yeah, I mean, I didn't see any other option at that point.
Yeah.
And so
remember when you mentioned
January of 2022, I had it.
I think we're lagging a little bit, but I remember when you mentioned tamoxifen, and I didn't know what it was really at the time, and I was so confused at why they would make you do it. And I also, there's just that like lack of information. I think too, going back to when you were telling the family, and when you're, trying to inform people, no one really just understands. I didn't understand.
So the genetic test, like they can't recommend things to you. They can tell you what your options are, but like there was not like a sense of urgency. Basically what happened was like they said I could come back every year, and every year they would have updated information on the testing that I had already had. So if anything came out in the genetic field that said like, we learned this about PALB2 or the recommendations have changed, I would find that out. And so every year I went for those tests, but like, it wasn't like they were like, well, if you don't get the mastectomy, you'll get cancer, or like, it was never like crystal clear like that. It was very like, here are your options, do with it as you will. And even the testing itself, it was very much, you had to sign authorization saying that like, I want this information, because some people really just don't want to know that, and it can alter like the way they think about things. And so like they were very careful to make sure that I wanted to know what I was going to find out, whether or not it was important to take action.
Right. And are you saying that before or after you finding out about me?
Before. And ironically, I don't know if you remember this, but the day that you found out, I was actually leaving the genetic doctor's office.
Yes, I do remember that.
You texted me while I was in the office. I was in the office with her, and you texted me that you had the results from your biopsy. And you told me as I was coming home from that same appointment. So I actually that same day emailed them back and said like, hey, I know we just talked like an hour ago, but it changed. My sister was diagnosed this morning, and you know, you and I are 5 years apart. You're younger, so like, does that change the recommendations for me or the urgency, etc.?
Yeah. Now, how much were you leaning toward doing any preventative measures prior to knowing, my diagnosis? I know you had like looked into it and insurance kind of turned you down, but if it wasn't insurance, would you have done those things or one of those things?
It's hard to say. Like, I know as a child, I remember, this is going to sound strange, but like, I remember reading the tabloids that mom used to keep at the house. And I remember reading about Angelina Jolie doing it.
Mhm.
And like, I used to be really flippant about it and be like, oh, well, if somebody told me I was going to get cancer, like, yeah, of course, I'm going to have a mastectomy. But then, like, when it's really happening, you're like, is it like, because it seems so extreme. Like, it seemed like an
Yeah.
extreme thing because you don't know, like, am I really going to get it? We had one person in our family who had had cancer and she had it later in life. Um, you know, our paternal grandmother.
You mean breast
And
cancer?
we breast cancer specifically, yeah. And like again, we had other cancers that we were kind of more concerned about realistically. Like our own mother had colon cancer, which is a whole different set of things that we were concerned about and already considering preventative measures. And like I'm very pro preventative treatment. I'm very pro preventative testing. Um, you know, the one thing mom had always said to us growing up was like, advocate for yourself because mom had issues like I did where she was sick a lot and there were not a lot of answers yet. Um, you know, now as I'm getting older, we're finding out that a lot of my stuff is autoimmune related, which might have been the same for mom also, but we don't know if mom would have had breast cancer. You know, the colon cancer happened first, but we don't know as she got older if that was a thing that was going to happen.
We don't know where we got the PALB2 mutation from, whether it was our mother or father died.
Yeah. And now we're not able to get that information about mom.
Right.
So that's its own thing and it's very personal. Some people really just don't want to know. Whether it's you know, they don't want that sense of responsibility. They don't want that for the same reason that the geneticist was asking me if I wanted the information. If I had the information, sometimes you feel like you're compelled to act, or sometimes you freeze and don't know how to act. And
Yeah.
you know, for me, I like to make educated decisions and I like knowing the answer. However, I also feel on the same hand, um, like a great pressure, like what if I made the wrong decision or if I don't do something, does that make it then my fault when I do get cancer? Or, you know, there's thoughts like
Yeah.
that, like it puts the pressure on you to like, you know, if something bad happens, then is it now my fault for not doing the right preventative measure? And that was something that I was kind of so like what you were asking about, would I have done it anyway? Maybe eventually. I hadn't been thinking about it in my near future. I had talked about it with Brian as like maybe later as I got a little older, closer to the age my grandmother was when she was diagnosed, that it would be an option, but I did not feel the urgency that I maybe should have.
But I don't think you necessarily should have. It's just because obviously now in hindsight we could say that we have an urgency. Your direct sister had, you know, cancer and breast cancer specifically, which is what PALB2, focuses on. But there is a smaller risk of, for those that don't know, smaller risk of ovarian cancer and pancreatic cancer. But again, I don't think, there's so much lack of knowledge. And also just when you're thrown into the world of like genetics and gene mutations and all of that is still being figured out. So how are we expected to really know the gravity of the situation, when that arises?
Yeah, and especially with breast cancer, the focus is on the BRCA gene.
Yeah.
It's so PALB2 is the protector and locator of BRCA. So it's related to the BRCA gene. Sometimes they call it BRCA3, but it's not the same. And it does have other aspects that it affects. So, like you were saying with ovarian cancer and pancreatic, there's not a whole lot to do to screen for pancreatic. Ovarian, same thing, and initially it wasn't recommended to have a hysterectomy. And then that changed too during one of my yearly visits, that the recommendation would be to have that once you're past having children. And in my case, which is completely, I guess, separate, I went through menopause at 38 years old spontaneously. Still not 100% sure why. The x-rays showed that my ovaries were very, very small for some reason. So in September of last year, I did have a total hysterectomy. So I guess, yeah, the difference where that lies between you and I is you still have the choice to do that. Whereas I already made the choice. Now, had I not gone through menopause on my own, they would not have done the hysterectomy. Based on the fact that, hormonally, they wouldn't want to reduce that too early. So for me, that's its own issue, separate from PALB2. But yeah, that's another issue that they don't have information on, like whether or not, like your cancer was hormone sensitive, and so it's hormone positive, exactly. So they are hesitant to give me hormone replacement therapy. So this year I was diagnosed with osteoporosis also. So that's another thing that I went to multiple doctors and I heard both sides of the story. Some people are saying like 100% do it. It's worth the risk, whatever. Other people are saying it's absolutely not worth the risk. And so as of right now, I've landed on it's not worth the risk.
Yeah, I feel like as, from like a Previvor standpoint, people are focused when somebody goes through cancer and all these choices that you have to make after you go through, what the Previvor is trying to prevent. The Previvor has to make makes similar decisions in terms of treatment. They do have to sometimes go through surgery and take medications and deal with menopause and all these things, but it's the unknown still. Like there's that lingering thought of, if I do this, is it going to even benefit me? Or, there's so many other unknowns, I think makes it really difficult for somebody in that position to choose these things. And to even know how to proceed.
Yeah, and I'm very big on insurance, which I guess is similar in the fact that I'm willing to pay money now to ensure that if something happens to me, I'll be protected. And people will say, well, what if nothing happens to you? Then you paid all that money. And it's like, but what if I didn't pay that money and it did happen? Like, I would rather have the assurance than not have the assurance. And I get that kind of spills over to this. In this specific case, I would rather have that surgery knowing that, it's not a guarantee still that I can't get breast cancer. As a matter of fact, a year after I went for my very first mammogram, so I had the reconstruction and I had to go for an MRI that first year just to make sure everything was in place and doing what it was supposed to, and something flagged and I had to go for a biopsy a year after my mastectomy. So while they remove most of your breast tissue, there's still small bits that aren't removed. And so it is possible to technically be diagnosed after having done this. And also the surgery wasn't easy. It turned into 3 surgeries, which is a whole complicated story in itself. So yeah, I mean, it's definitely a decision, and your family has to be on board. And, fortunately my husband was super understanding. On the same hand, it was difficult to explain, while my father and brother are supportive of the situation, initially they did not understand it, and they didn't understand, I guess, what to them appeared as surgery for the sake of surgery. For me, having done the research and knowing the background, I understood that, the medical side of it. I also knew more about, I think, what you were going through than they might have.
You, as a human in general, are just you're proactive, and you care about these things. You care. And I think that is, a huge testament to all the choices that you've made. And I think that allow my sister, Jaime, to be kind of, an example of advocating for yourself, even if other people don't agree, because of the lack of knowledge. Like with my brother, with our father, they just didn't understand. So they couldn't understand why someone who wasn't sick with cancer going through all of these things. But, now your sister has cancer, and I feel like that showed them, that this is actually serious.
Yeah. And in my life, I'm one of those people that likes to learn from other people's mistakes. I was not one of those kids that said, I have to try this and I have to try that because I have to see for myself. I like to not make mistakes. So for me, I keep thinking what happens to other people, and I want to see, and not just one person. Like I look at people as a whole, yeah, and I'm like, I don't need to make certain mistakes to know that they're not great to do.
Yeah. What would you say to somebody who maybe was just finding out that they have a genetic mutation? Do you have any insight that you would want to give them after kind of all the things that you've experienced?
First, I would say don't panic, because I think some people kind of take that as a cancer diagnosis.
Yeah.
So, like, I know you said in your last episode that you're not a Facebook group person, but one of the first things I did was follow a Facebook group because I just wanted to see what people were saying and what other people's initial reactions were, because mine was definitely not, I need to go have surgery. And in these groups, I see some people come on there and they were just diagnosed that day with the PALB2 gene. And the level of panic is massive. It's basically like someone saying, like, here's a death sentence. For me, I didn't feel that way. I felt like here is another piece of data that I could use to inform my medical care going forward. And then when it happened to you, I mean, you were younger than they were even recommending for me to go for the preventative testing.
Right.
You were not 35. So, even you got it before they would have even started testing you.
Yeah, I got it, because you were positive for the genetic mutation. I was able to get the testing done for, I think, or if I just did that mutation, it would have been free. But I chose to do the whole panel as well. I paid extra money for that, but that was the reason I did it. I wouldn't have done it otherwise if it wasn't for you having a positive mutation. So I'm sure there's so many people in that position where why would you have that information? Like, why would you just randomly get genetic testing if there wasn't question about something like you had things going on that led you to have genetic testing?
And, now that genetic testing is a thing, I think many more people will be getting that testing. Now, obviously, you've had cancer. So when your children are 18, I'm sure you're going to give them the option to go do that, so they can make informed medical decisions for themselves as they get older at an earlier age than we were able to. And insurance is probably going to evolve to say, like, yeah, I am going to cover that preventative testing and I am going to cover genetic testing, as all these children of people who could have benefited from that are getting older.
Yeah, absolutely. I really hope it goes in that direction, because just from what we've experienced and just the crazy amount of change and the cost and the amount of surgeries, and even it just needs to be more on the forefront. And even certain, like PALB2, a lot of people don't hear about that. They aren't aware of it. It's all BRCA, which is obviously very important. But I think the reason that we're talking about it today is so more people are aware of it, and understand the gravity of the situation, more on a like an empowered standpoint versus fear or anything else like that. Because I think feeling empowered, and I think, again, you're a great example of that, because you've, just taken all the information you've received about your health and used that in regards to your health, especially in regards to PALB2.
Yeah. And ironically, as far as communicating about it goes, I'm very public with my life. I put a lot of things on social media. But when it comes to really personal stuff like this, I don't share much. And you, on the other hand, don't share a whole lot on social media. And when it comes to your cancer, you share everything, and it's really admirable. And even, stuff like this, this isn't exactly like a comfortable situation for me to be talking about publicly. But also, I realized, after I did come forward once and say something about the fact that I had the surgery. And people came out of the woodwork. Like, I
Yeah.
didn't know that there were so many people in my life that had had the surgery. And had I known that beforehand, my journey might have been a little easier. And not that I want people to like hang flags outside their house saying I went through this, but it's I don't know. I don't know what the right thing to say here is, but I think um, if you have the ability to share even a small bit, just so there are resources. Like, my friends now know that if something like this happens in their future, that they can reach out to me and I'll share that experience.
What do you think that fear is of? Obviously, it's fine if somebody doesn't want to share this information. It's very personal. But I do feel like there is kind of a stigma about it. I actually remember um, I I was talking to a friend of mine who had another friend who was diagnosed, and I'll never forget it. But she said her friend felt dirty after a diagnosis, and it was just a weird thing to hear because I don't agree with that necessarily, but there is that there's that negative connotation behind cancer and even any medical, you know, any medical or health issues.
There's
And
judgment. I mean, specifically with breast cancer, what you choose to do after the mastectomy can be complicated. Like, I never grew up saying I was going to be someone who had implants.
right.
So that in itself is like a strange choice. You're making a choice as to whether or not you want to be flat chested and not recognize yourself in certain ways. You're making decisions about whether or not you want to have fat transfers, whether or not you want to have skin grafting. You're making decisions about whether or not you want to have saline or silicone implants. These are things that I never personally thought I was going to ever have to deal with. And as far as making that decision, um, I think I personally would have been fine going flat chested. It wasn't like my first choice necessarily, but also like I don't think I was against it either. And that, came down to a conversation with my family about about what the thought should be. And with my history with autoimmune disorders, there was a real possibility that my body rejected the implants in general.
Yeah.
So after my first surgery, I had issues with um, capsular contraction and basically my one side was rejecting, and so basically what had to happen is they took them from under the muscle and in a whole separate surgery put them on top of the muscle, um, which initially went well, and then I went home the night of that surgery and just my body just started filling with blood, and I ended up having a hematoma and having to go back to the hospital that night and had an emergency surgery to flush that out. And even still, the implants flip. There's like other situations that happen that, aren't comfortable. It's much better now, but the going was slow as far as recovery. Much slower than I think anyone around me understood. Uh, I didn't feel like myself physically for almost a year. And then at that year mark, then I made the decision to have the hysterectomy. So it was 2 full years of just surgeries. And in between all that, other biopsies for other things. So yeah, I was put under 7 times in 2 years.
That's so much. And I think that, that's just hearing that, like knowing what you've already experienced, but also hearing it again. That's so heavy. That's a lot of things, especially in the time frame. And not only do you have to go through these things, you're changing your body. Like, these are huge life adjustments that it's not just you didn't have cancer, but you made these choices preventatively. Like, no, you had this circumstance you were thrown into. You had to make these choices. And now you have to live with some of these things that go on longer than just a decision. And I do think that that's not understood well in the Previvor world.
Well, and on the same hand, you are actively going through cancer and chemo and having a baby. And you, I mean, in my life, are my primary support too. So there was some level of, what she's dealing with is like 1,000 times more intense. So, I mean, it was inspiring to me, and it helped me push through because I felt like I had a
Yeah.
choice where you didn't, which I also felt guilty about for a long time, still kind of a little bit.
There's
But there's
no,
also,
I'd prefer it
like,
this way. Thank you.
the way it was expressed to me with, with our brother and our father, there's something to what they were saying. Like, it is a choice that I made. And so, I kind of felt like I didn't have a lot of room to talk about it negatively because it
Yeah.
was a choice. But there were a lot of difficult parts to it that, you don't expect. There's some isolation to it. Um,
Mhm.
you don't know things until you go through them. I've known people in my life who've had breast cancer, and I look back on, you know, how maybe I would casually look over a story about it, or I don't know. You don't know. You don't know until you've done it
And it's true.
yourself. And so, yeah, I mean, the more people talk about it, the more it becomes something that maybe more people understand. And that's, one of the reasons I agreed to do this with you today. Um, because it is important. It's uncomfortable to talk about. I have two stepchildren, and I had to explain to them the type of surgery I was having, um, which, it's not comfortable. I had to explain why I can't use my arm, why I can't wrestle, why I can't play, why we can't, um, and again, because it was a choice, it was something that I had to firmly stand behind. Like,
Yeah.
when it was frustrating to, people around me, it was like I agree with my own decision.
So did you ever
I
battle?
had the support of my in-laws.
Did you ever battle with those some of those choices afterwards? Like, what, did I make a mistake, or I wish I didn't do this, or anything like that?
No, definitely not. I think I made very educated decisions, and I did the homework beforehand. And I still think that, at least from a breast cancer and ovarian cancer standpoint, I made the right decision. Would I have maybe not done the implants had I known how complicated it was going to be? That's up for debate. Because
Right,
initially I was going to go in for the double mastectomy and reconstruction in one procedure. It was supposed to be one procedure for me.
right.
Um, and it ended up being three. I ended up being out of work for 4.5 months, and it was way more drastic than it had intended to be. And I ended up with frozen shoulder, and I ended up with extra physical therapy. Um, the scarring caused cording. There was just like a lot of things that came from it that weren't part of the initial plan,
Yeah.
which I don't, no one expected.
Yeah, it was really hard to hear that you were experiencing those things when you were. Just knowing, because I had some insight to some of the things that you experienced, and then knowing how scary that could be, and how, tiring and on your body and your just life in general. Um, and it was hard a little bit to watch that. Um, but I do feel that in some weird way that we've connected, and there's certain things that we've experienced that not a lot of, siblings could experience when one of them has cancer.
Yeah.
In terms of like the treatment and things like that, where even menopause, there's a lot of things that I think
Yeah.
that we were able to lean on each other a little bit more so than normal, because there it was some of that understanding, which, like you said, you don't understand until you go through it. So I'm very glad that we had each other through that.
For sure. I mean, sometimes I say stuff out loud, and I'm like, the only person in the world who will understand this is my sister.
I know.
And I like,
It's,
from that standpoint, I don't think you understand the level of like what went through my head the day that you told me that you were sick.
yeah.
If I could never have that day ever again. Like that,
Same.
there was a life before that and after that. And
Yeah.
to watch you have to change and become a different version of yourself and watch you struggle with dealing with that was, you know, you don't wish that on anyone. And I, like you and I have always been closer than just sisters.
Yeah.
We've spent, we've had a weird life and we've, you know, been through a lot of things together that, you know, the average sister may or may not experience.
Yeah.
So like, well, I love that we have this in common. I hate that you had to go through what you went
Yeah.
through, what you're still going through.
I always say it's harder. I don't want to be that person watching somebody go through that. You know, I'd rather endure that pain myself than anybody I love.
Yeah.
And even I say that now in a different light too, because, you know, like we just talked about, our mother had cancer. She went through her own, you know, experience and treatment. And from the lens that I had as, what was I, 20, you know, late teens, early 20s. And it was hard then. And now, even having the knowledge of going through it, you know, it's just, I would never want somebody to have just the eyesight on what's going on. There's no control. There's nothing you can do. That's a hard spot to be in.
And from a stranger standpoint, like this happened to you in like a post-COVID world where there were still masks, there were still people who could come to appointments.
Yeah.
And both you and I kind of react to our own medical care similarly, where, you know, we don't want other people at our appointments always. We don't, you know, we kind of deal with our medical stuff ourselves and then come home
Suffer in
at
silence.
it. But like, it's not, we don't, not even that. I mean, maybe, but like to a point, it's almost easier when you're only dealing what's going on in your own head
Yeah.
rather than worrying about the person that you're with.
Yeah, it's true.
Because there's a lot of, you know, I volunteered to come to you, with you to certain things, and you know, you were very clear about like, no, I kind of just do my own thing. You know, and with me, like my in-laws had offered to go to appointments with me also, and it was very much like, no, it's fine. Like, and it was fine. Like I kind of, those are like,
I think there's
to do by myself.
there's times that those things are good, and there's times that are not. When you're going through, you know, all these crazy, like the craziness and the ups and downs and treatment or not treatment, feeling like not well, you know, some days you want physical or somebody there with you and like physical support, or, you know, even just talking to somebody. Some days talking is hard or it's not, you know, it changes depending on the day, depending what you're going through in that moment. It's not, you know, like a linear thing when you're going through treatment. And I'm sure that was the same for you, because I'm sure you had your own things to battle as you were experiencing all this, especially with all the complications and things like that.
Yeah. And like you mentioned in your last episode about the husbands, you know, this is a lot on them. And I had approached my husband about the fact that I was going to have a surgery that was kind of dramatic and drastic. And he was great and offered to go to all the appointments, and the ones that involved information, I did have him come along to, so that he could hear it from someone educated and not out of my mouth. But it's a lot to ask of your partner to say, hey, again, like I'm choosing to do this and you're going to have to deal with the aftermath.
Yeah.
You know, and then when that spreads and, you know, and I'm different after, like there's no question that I'm a different person since then.
Yeah.
If that is not clear to you, at least.
No, that makes,
I feel like there's always that part of you as you're growing up that feels like you're still kind of youthful. And I have never felt more adult than that situation.
yeah, there's just like, I could see like there's a line, like the before and then just the after that continues. There's no end really to that.
And tie that into all the other medical stuff that was already happening.
Yeah.
You know, my healing factor is not great. My infection rate is not great.
Yeah. Now, when you, going back to Brian, like the caregiver situation, having to have him on board, your husband, what did you have to educate him in the beginning? Was he aware at all of this before you went to the doctors and things with him?
Kind of, and not also. So I'm a talker. I'm one of those people that likes to give all the information. just because I don't like to leave things unsaid and then have that be the thing that causes trouble later. So when I first had the diagnosis of the PALB2, I was open with him about what it was. But then, unless you go and look it up yourself, you're not really going to know. And then by the time that I made those choices, there were so many aspects to it that I actually made a PowerPoint presentation and gave it to him so that
Spot
there's
on.
like a clear distinction between what was related to the PALB2, what was related to the surgeries, what was related to the autoimmune stuff, because it's a lot to deal with. And then on top of that, there's also things like, updating wills that nobody talks about, having conversations in your late 30s and early 40s about what's going to happen if this isn't great. When I went in for that third surgery, I was there was the DNR option. She's, signed for the blood transfusion. If this goes south, make sure your will's on file, all that. Like, there's just a lot of things that you don't expect to deal with. I mean, at any stage of your life, but certainly not this one.
Yeah.
And making sure that we knew how to get into each other's devices, that we knew what bills the other person pays, so that in case of, bad stuff happening, that the other person can pick up where they need to. There's just things that you just don't want to deal with that you have to deal with, which after the fact, it's been helpful. And I find that a lot of people call me the first time they're ever experiencing something like this. And it's a double-edged sword. Like, for us, we lost our parent at an early age. And now I find that when I have friends that lose a parent for the first time, I'm the first call. And part of me is really grateful for that. And part of me hates it.
Yeah.
I want to be there, but I hate the fact that my friends are going through those kinds of things. And those are the things I don't want to relate to people on. I don't want them to have to go through that. And I'm sure you feel the same when you meet people who have dealt with cancer. You love people with all your heart, but you don't want them to have to go through those things.
Weird. It's a weird balance, I'm sure, in your brain because whenever I meet somebody, I always, I obviously say nice to meet you, and then I say I apologize that we have this in common, and but it's unfortunate, and it's that there's a common thing said, especially in like this community, I guess you'd call it, is that it's a crappy community to be in, but has the best people because they are very supportive. You go through something like this, and you do want to do what you can to help somebody who is in shoes that you had been in, and you see all those, holes, and even it's just a wild ride.
Which is like, for sure. For sure.
Now in going forward for you, what is your plan, just having the knowledge that you have with all of your health issues, as well as, the genetic mutation? Do you have anything that you are trying to do in your life to make you feel like you do have control, or to combat all of these things? Like, what are your priorities in terms of your lifestyle?
Directly related to the PALB2 stuff, I will continue to go. I see my surgical oncologist yearly. I do yearly MRIs with the dye. And I'll continue to go to those appointments and continue to go to the genetic appointments. As far as the other stuff, I mean, osteoporosis is a side effect of having gone through menopause early, the hysterectomy, things like that. So that's something that I'm learning to deal with. So I've joined a gym. I've started working with a trainer. So right after having my bone scan, I broke my wrist, which kind of pushed the diagnosis directly into osteoporosis. And since then, I had to start taking, I take
literally like hot out of bed, right?
Yeah. So I take weekly this medication that is supposed to strengthen my bones, but you can only take it for 5 years. And then after that, they'll do another scan and decide whether or not I'll have to do infusions. But infusions, put you into the immunosuppressed category, which is not somewhere I want to be, especially when I already have an autoimmune disorder. So there's a lot like going down the line. I see cardiology all the time too, because that's another risk that comes with the lack of hormones that I currently have is heart issues down the line. So yeah, I just stay on top of things. I ask questions when I don't feel right about something. I get a second opinion. I'm not that I like being a squeaky wheel, but also like
You have to be.
I don't ever want to say that I didn't ask enough questions because someone made me feel bad. And that's the hardest part is like doctors are just people and they have good days and bad days. And they don't realize sometimes when they're casual about something they shouldn't be casual about, or not super thorough about something they think they're being super thorough about, or missing something because they're looking for something else. Like all of those things are normal things. And I may read my chart and say, hey, like you didn't write down what I said here, or, um, I looked at my result here and you said there was nothing to talk about, but I kind of want to talk about this. And that might be annoying and I don't care.
Yeah, no,
But like, you have to, everyone you've interviewed so far has had situations where they advocated for themselves and that's how they got the diagnosis. And it's so easy to feel shame or feel frustrated. I can't tell you how frustrated it's been for me, especially with the autoimmune stuff, because, you know, blood test levels come back different. And sometimes it looks like you're fine. And sometimes, you just seem like you're saying things when they can't physically see what's wrong with you. A lot of the symptoms are things that only you experience, but no one knows your body better than you, and you can't let that frustration stop you from getting the help you need.
I'm so glad you said that because I think that is vital for people to understand whether they're, in health in general, healthcare in general, but also if you have just found out you had a diagnosis, or even a genetic mutation, it's important to be able to speak up. And if you don't feel comfortable, I think it's a vital too to have somebody who you trust. If I didn't feel comfortable myself, you would be the first person I call to handle all of that for me because you have a very, you have a really good way about yourself and keeping track of everything. So if you feel like you can't do it yourself, I feel like it is something important. You should have somebody else that you trust as well to advocate for you because sometimes it's really hard to, even if you feel you don't want to hurt, not hurt somebody's feelings or you don't want to speak up. Sometimes it's just hard for people in general as just their base state. So you feel like
I mean, I don't want to be annoying.
Yeah.
I dislike being annoying. I dislike when people think that I have things that are in my head. I don't like to have people question the things that I say. And I can't tell you how many doctor's appointments I've left and come home crying because I felt like I was being clear and the other person just wasn't responding the way I needed them to respond. And, there are people that I know personally who took that situation and then didn't go see a doctor for a long time. And then when they did, that got results that they didn't want. And I don't want to be that person. And I don't want to be disrespectful to the medical field either because I love doctors and I think that all of them work really hard and their intent is always positive. But again, you don't know until you know. And like you mentioned in your last episode, Dr. Cardonic, who, recently became a cancer patient, I'm sure the way that she talks to patients, even if she was great before, I'm sure that she's better now because having that firsthand knowledge makes a huge difference. And you deal with doctors who they learn a lot about medicine and they learn a lot about, being a doctor, but that people part, that empathy part is something that you can't always train. And a lot of that comes just from experience and not that I want people to experience the things we experience, but I think it's also important, I think, for the medical field to start empathy training maybe. There's something so important about being able to explain to a patient in the way that they need to hear it in order for them to even understand.
I remember before I used to say, like, I don't care if my doctor is nice to me. I just want him to know or he or she knows what they're doing and I'll be fine. Like, I don't need I don't need wonderful bedside manner. I didn't need all of that. I also didn't have an extensive medical history. So,
Yeah.
and that has being a patient and going through all of that, it's opened my eyes a lot more, and how delicate that balance is. And like you said, doctors are humans, and we do have to understand that to a degree, but that doesn't mean we can't advocate for ourselves. And, while they might be a nice person, you are allowed to get a second opinion. You're allowed to change your doctor. You're allowed to do these things for whatever reason you feel necessary. And it doesn't have to make sense to anybody else. It could just be that you.
Yeah, I like that. I know that specifically, like, you dealt with that on multiple occasions initially when it came to um, how you were going to handle. I mean, the fact that you had cancer itself was a whole situation, but the fact that you were also pregnant, like getting extra opinions and finding out more about um, someone who could advocate for Avery too.
Yeah.
Having so many different opinions. And I know at the time you were like afraid, maybe not afraid, but you were questioning whether or not it was going to offend your initial doctor. And
Mhm.
that has nothing to do with it, honestly. It has
Yeah, I
nothing to
do.
do with it. It's what's going to get you the best care. And if you have to ask 12 people, then you ask 12 people.
Yeah, I do remember that I really, still enjoy my oncologist, but there was a point where I didn't feel comfortable, and I really had a hard time. I had a hard time trying to decide what the next step was for me. Like, should I leave this doctor and go to a different one? I ended up staying with him and finding what I call my backup oncologist, because I consult with her when I have questions. So I just feel like I found my way. I found my way to be comfortable and well-rounded. But it did take a lot of support for me to get there, because I am not the kind of person that wants to confront people or cause issues. So that's just who I am as a person. And I've done a lot of learning along the way. So it's easier said than done, but it's so important to your career.
Yeah. And some of it is, the ability to have those confrontations, but a lot of it, it helps to be educated. If you're asking questions and you haven't done your research first, that's not helpful. But if you come with a background and have educated questions to ask, then you should be getting people that are paying attention to you. And if they feel too busy, then find someone else. Like, you cannot wait in times like that. You know,
Yeah.
minutes matter, days matter, weeks matter. Um, and it might not even be something that doctor did. It just might be something that you feel. If you don't feel like it's the right fit, then it's not the right fit. And that's it.
Yeah, absolutely. I feel like we could talk about this for like hours and hours and hours. Whether it's I think about that we do. It's about that, whether it's about like healthcare or even just, the things that we've experienced, PALB2, all these things. We could definitely go on. But just to close it, or just to finish up, is there anything that you want to leave, any advice, any tips, or things that you learned on the way that you want to kind of leave for the listeners?
Something that isn't talked about a lot is medical terminology. You are a nurse and I was a pharmacy technician, and we both have a background that explained a lot of this. So when doctors talk to us, we know the words they're using. I noticed throughout all this stuff for me, the way that I was spoken to about the things that were going on, I don't think a lot of people really understand. The questions that you and I ask are because we know what certain things mean. Like, there are people who hear terms like malignant or benign, and they're told that XYZ was malignant and don't really understand what that means until they go home and Google it. So it's super important that if you don't understand the terminology that you're asking in the office, if you're reading your doctor's notes and you're not understanding what they're saying, ask questions, look up the terms, make sure that you understand what's being told to you, because your doctor isn't going to cry or laugh or tell you it's good or bad. They're just going to tell you. So their response is not necessarily the response you should have. They could be telling you really drastic information and you're not receiving it in a way that says, holy moly, this is urgent.
That's valid.
So
Completely valid.
yeah, I would encourage people to, ask your doctor to say it in even if you have to look at them and say, listen, tell me this the way you would tell a 5-year-old child, then that's what you have to do.
Yeah, I would honestly prefer it that way, to be honest. But that's easier.
Yeah.
And even actually from a perspective of a nurse, and sometimes my doctors knew that, whether they saw it in my chart or not. Sometimes when you are in the healthcare field yourself, people don't want to offend you, and they will try to not purposely leave out information, but they also don't want to they don't want to make you feel like they thought you didn't know. So they might actually not say things because they think that you, being in the healthcare field, are aware, which, I always just say, if somebody brings up the fact that I was in the healthcare field, they just say, talk to me like I was not. That's it. I just want to know exactly what you need to tell me, because while it sounds so small, it really makes a big difference when you specify your needs. And, again, I just asked for clarification. I think that is a really good point. So thank you, Jaime. I really appreciate your time. And hopefully we can get you on here again to continue the conversation, because I think it's an important one. Now, if somebody wants to reach out to you and if they have questions, are you willing to do that? And if so, where could people find you?
Sure. So I have a private Instagram account. It's always forward, never boring. But yeah, definitely feel free, shoot me a message. Yeah, I'm happy to talk to anyone who's dealing with anything related to the genetic testing or anything similar. But yeah, I really appreciate you having me on here. I love what you're doing with this whole podcast situation, and you're drawing attention to something that is hard to hear about, and you're putting it in ways that are making it more accessible. It's really important that you're doing it.
I appreciate that. Thank you so much. I love when we hype each other up. It makes me feel so good. But thank you, and we will see you in the next one.